Hey y'all, I'm Jasmine and welcome back to my YouTube channel. So in today's video, I'm going to be giving you guys tips to prepare for clinical rotations. This can be your intro clinical rotations or the rotations that you take during your last year of school. Ultimately, I want you guys to be great students, have great relationships with your preceptors, and learn a lot. So if you're interested, keep watching. Also, make sure you guys like, comment, and subscribe to know more about me, my lifestyle and pharmacy, and to get a dose of Jasmine. Thanks for watching, y'all. So my first tip to prepare for clinical rotations is to treat every rotation like it's an interview. So early on in pharmacy school, I heard this quote from an upperclassman, and it is so true. Your preceptors are essentially your boss for whatever time period you're with them, and you want to leave a great first impression. So show up every day on time. Do all the bare minimum things that are expected of a great person coming to an interview. Come late, be prepared, all those things. So ultimately treat every clinical rotation like it's an interview and always put your best foot forward. Okay, so my next tip is to make sure that you email your preceptor a few weeks prior to actually starting your rotation. So 2 to 4 weeks is a good time period to send your intro email. And in your intro email, you want to, number one, introduce yourself, but number two, you want to set clear expectations for what you hope to gain from the internship or from the rotation. So your ultimate goals from that rotation experience, things you want to learn, things you're interested in, and then beyond that, your ultimate career goals, so that your preceptor is able to align your experiences with what you want to do in the long term. So with that, if you're unsure of what you want to do, like me at some of my rotations, you can clearly state that to your preceptor and let them know that you are open-minded to other opportunities and that this experience is one that's going to help you cultivate your ultimate career goals. So number one, make sure you send an introductory email, introduce yourself, give your clear goals and expectations for the rotation, and then ultimately ask your preceptor what their goals and expectations are for you as a student. That way you guys are on the same page and ready to start once you get to your rotation site. And then lastly, you want to make sure that you ask if there's any materials that you should review prior to coming to the rotation, whether that be journal articles, guidelines, different disease states you should review more information about. But you want to be prepared on day one so that when you show up, you will be able to jump in and learn as much as possible. So along with that tip, you want to research your preceptor. And I know this sounds kind of creepy, like, okay, I need to Google the person I'm going to be working with. But yes, there's no way that you're going to know exactly what your preceptor specializes in if you don't Google them. By Googling them, you can see the disease states that they typically work with. You can see different articles that they've published. Sometimes you can find their CV to see where they went to school and things like that. But ultimately, you want to know more about your preceptor so that when you send that email, it isn't going to be about things that you can easily find on the internet. So for example, if you are doing a clinical rotation in nephrology, for example, or with kidneys, you should know that your preceptor wants you to know basic things about renal function just because of the nature of the rotation. So I wouldn't necessarily ask in the email if they wanted me to review common disease states with patients in nephrology, if you can just find that online. So put your best foot forward, research your preceptor, and see the things that they specialize in so that you can be a bit more familiar before sending your intro email and before actually meeting them. So the next thing is, if you are able to, try to share your CV with your preceptor. That way they are familiar with your previous experiences and they're able to know where you're coming in. So essentially they're able to know what disease states you should already be familiar with and what things you're interested in. That way they can tailor the experience to something that maybe also is beneficial for you. So my next tip, I have kind of already mentioned this, but preceptors have pretty high expectations for students. So before coming in on your first day, you should research, study, and know about the disease states that your preceptor may ask you about. So for example, right now I'm in a primary care clinic and I Googled, and my preceptor does a lot of diabetes work. She does hypertension work. So prior to starting my rotation experience, I looked over the diabetes guidelines so that when I had topic discussions about diabetes, I was able to effectively talk about new medications, different medications, their impacts on patients with comorbidities. So when you show up, you don't look clueless. And it also leaves a good first impression to your preceptor. So along with that, it's okay to not know specifically what your preceptor may expect, but it is showing that you're curious and that you are genuinely interested in learning if you put forth one step before asking a question. So when you're preparing for your rotation experience, it's important to show up and say things like, okay, I've looked into this, but I can't find the specific answer that I'm looking for, because it tells your preceptor that you have actually taken the time to look something up. You have actively been working to learn rather than just asking questions without doing your own research. So with that, it's important to ask questions of substance that aren't easily attainable. And when you do ask questions, try to show that you've actually put forth effort. It really goes a long way. And lots of preceptors have given me good feedback about that, because it's one thing to ask questions, but it's another thing to ask an elevated question based on something that you've already looked up. So my next tip is pretty easy. It is to do the bare minimum. So do the bare minimum of what is expected of you. And I say that because as a student, you should go far above what the bare minimum is, but these are things that are red flags for any preceptor. So show up early if you can, but show up on time at the latest. Never come late, and that's the bare minimum. You should show up prior to your preceptor expecting you to be there, just because it allows you to, number one, get yourself prepared, and number two, actively have everything open on your computer that you need to have open when you talk to your preceptor in the morning. So for example, I have patients to present to my preceptor in the morning, and my time of arrival is typically 8:15, but I get there early so that I'm able to, number one, open patients' medical charts, number two, review my notes about the patient, number three, to open my basically messenger app that I have to use to talk to my preceptor, and then number four, to open the shared drive. So if there's anything my preceptor has shared with me the day before, I'm able to open it and quickly look at it just so we can talk about it that morning. So arriving early is essential to make sure that you're not only there, but you're prepared when your preceptor wants to talk to you about something. So number two is arrive dressed appropriately. So some locations have scrubs, obviously, that you can wear. Some locations require business casual. Some locations allow you to wear jeans and a t-shirt. It just depends on the culture or the environment of the institution. So with that, it's okay to ask your preceptor what things you should wear or what you should be expected to wear on rotations, just because it's easier to ask versus just to show up in a business suit and everybody else is wearing scrubs. So ask what to wear, but always arrive dressed appropriately for that setting. I will also say, if you're in a pharmacy that's a clean room, it's important to ask about specifics, just because you can't show up to a clean room with nails, you can't wear makeup, you can't wear jewelry, you need to wear pants that cover your ankles. So ask all these questions before you show up, because you don't want to be ill prepared and not be able to participate in that experience. And then another bare minimum is to make sure that you eat before you get started and have a snack in your pocket, because the first day you never know what to expect. So you don't know when meal breaks are, you don't know when you're going to be able to go to the bathroom, all those things. So if you eat before, you're able to actively make sure that you're not hungry while on rounds for patients. So it's really embarrassing to be going through a patient chart on the first day, talking to your preceptor and your stomach is growling. It's not cute. So make sure you eat breakfast before you come in so you're able to think clearly. You won't have episodes of hypoglycemia so that you won't have headaches or feel unwell while you are trying to learn as much as possible and leave a good first impression. So eat some food, dress appropriately, be early, and literally just be curious and engaged. Show that you want to be there. Don't be on your phone. Don't play on your Apple Watch, because some preceptors are very hip and they know that Apple Watches can send text messages and things like that. So genuinely be engaged, show up, put your best foot forward, and try to leave a good first impression. That's it. These rotations don't last that long. They last 4 to 6 weeks for the most part for most universities. So you only have 4 to 6 weeks to let this preceptor know that you are serious and that you really want to learn as much as possible. And pro tip, these are the people who are going to write your letters of recommendations for residency programs. So you need to leave a good first impression or a good lasting impression for your preceptors. So my next tip is to ask upperclassmen or your classmates who've had your preceptor before what type of person they are, their personality, what types of things they expect from students, what they like, what they dislike, just so that you're able to show up and effectively be a great student for the first day. It's always difficult meeting somebody for the first time. So the more you know about that person, the more you're able to prepare, and the more you're able to have a great first day rather than showing up not knowing each other, not knowing anything about each other, and literally going in blind. So try to ask around, do some market research to figure out more about your preceptor. That way you can show up prepared for the day and have a good first day. All right, thank you guys so much for watching today's video. I hope it was beneficial about how to prepare for rotations. I know that these tips have helped me to excel and have good relationships with my preceptors in the past. Hopefully these tips will keep working for me. If you guys have any video requests, please leave them down below. Of course, I read all the comments. I try to respond to all of them, but obviously I'm on rotation right now, so it's a little bit difficult. But again, thank you guys so much for watching. Make sure y'all like, comment, and subscribe to know more about me, my lifestyle, and pharmacy, and get a dose of Jasmine. I will see you in my next video. It's gonna be popping up on the screen, so click on it. I'll see you guys later. Bye.